Good take care of a newborn baby and a growing child.
The newborn must be given a good start in life through proper care in a healthy environment, especially during infancy. It is during this stage that babies often die due to parents' neglect and ignorance. Knowledge of the appearance and characteristic of the newborn will assure the parents that the baby is growing normally. It is equally important that proper care of the newborn be mastered. This includes daily care of the skin and navel and choice of suitable clothing. It also includes feeding, bathing, and immunizations. Care of the infant begins with the preparations before the baby is actually born. In emergency cases, when the physician is absent, someone should help the mother in childbirth and take care of the baby until the doctor arrives. Here are some guidelines for the care and treatment of the newborn during the neonatal. 1. The nose, mouth, eyes, and umbilical cord require close attention and protection during the first few hours after birth to safeguard against infection. 2. Keep the baby warm during the next 12 hours after birth. Do not feed it during this time. 3. A daily bath for the baby is essential to cleanliness and good habit training. In bathing the baby, make sure the room is free from draft. The articles needed for the baby are both needed. And the bath is warm enough. Clean the baby's head first before the rest of its body. 4. There are 3 ways to feed an infant by breast, bottle, or waist. Breastfeeding is the most natural and accepted method to nurse an infant as mother's milk is natural, instantly available, and contains all the nutrients that the baby needs. However, it is not desirable to breastfeed the baby when the mother is in poor health or ill with infectious diseases. Mothers with inverted nipples and those without adequate milk supply resorts to bottle feeding. A combination of breast and bottle feeding known as mixed feeding is used when the mother is away from home for periods longer than the feeding intervals. The regular feeding schedule usually has 3 to 5 hours interval, although the baby's hunger is considered the best clock to go by. 5. The newborn requires regular immunization to protect it from infection and diseases. Immunization will prevent the newborn from contracting any disease that may affect it for life or even cause death. An immunization guide is available at health centers or doctor's clinics. Immunizing vaccines are given at arbitrary times. Effective immunization are available for whooping cough, diphtheria, tetanus, poliomyelitis, tuberculosis, and measles. Parents should always keep a record of the baby's immunizations. How to take care of a growing child. Work to develop caring, loving relationship with your kids. Children learn caring and respect when we are treated that way. When our children feel loved, they also become attached to us. That attachment makes them more receptive to our values and teachings. Loving our children takes many forms, such as spending with their physical and emotional needs, providing a stable and secure family environment, showing affection, respecting their individual personalities, taking a genuine interest in their lives, talking about things that matter, and affirming their efforts and achievements. Regular time together, plan regular emotionally intimate time with your children. Some parents and caretakers do this through nightly bedtime reading or other shared activity. Some build one-on-one time with their children into their weekly schedules rather than leaving it to chance. You might, for example, spend one Saturday afternoon a month with each of your children doing something you both enjoy. Encourage safe exploration and play. As infants grow, they begin to explore the world beyond their child care providers. Parents should encourage this exploration. While many of us think of learning as simply acquiring facts, children actually learn through play. Use discipline as an opportunity to teach. In addition to consistent and loving adult supervision, teach your child limits. Never hit or shake a child. Recognize that each child is unique. Children grow at different rates. Their ideas and feelings about themselves reflect, in large measure, parents and providers' attitude towards them. Choose quality childcare and stay involved. Frequently visit your childcare provider and seek someone who responds warmly and responsibly to your baby's needs.